Hey everyone, welcome to Massage Therapy. I'm Moy, and today I'm gonna show you how to test for carpal tunnel syndrome, whether you're checking in on yourself at home or if you're a massage therapist assessing your patients. Now, let's be clear. This is not a diagnosis. These tests just give us useful clues about what might be going on. If symptoms show up, it's always best if you ask your doctor for full evaluation. Cool beans? Alrighty, let's get into 4 tests you can do at home or in your treatment room, starting with the most classic one of them, the Phalen's test. Bring both of your hands in front of you and press the back of your hands together, like you're making an upside down prayer pose. Keep the wrist fully flexed, fingertips pointing down, and hold this position for about 30 to 60 seconds. Really push the index and middle finger knuckles until you feel deep flexion into the wrist. You're looking for familiar symptoms: numbness, tingling, or pain in the thumb, index, middle, or half of the ring finger. If those sensations show up during the hold, that's considered a positive Phalen's test and could indicate you might have compression inside of the carpal tunnel. What is carpal tunnel syndrome anyways? Inside of your wrist, you have a very narrow passageway called the carpal tunnel. Picture a little tunnel made of bones and ligaments, just big enough to let a few tendons and one major nerve, the median nerve, pass through. The nerve runs from your forearm down into the hand and is in charge of the sensation in the thumb, index, middle, and part of the ring finger. It also helps control some of the thumb's movements. Now, when the carpal tunnel becomes cramped due to inflammation, swelling, or pressure, guess what gets squished? That's right, the median nerve. And when the nerve gets compressed, it can cause all kinds of issues, like tingling or numbness in your fingers, pain that shoots down your arm, weakness in your grip, and waking up in the middle of the night to having to shake your arms out. Next up is the reverse Phalen's test. This one is best suited for you or your patients if you already have a lot of symptoms or feeling a little sensitive in the wrist or hands. Bring your palms together in front of your chest, like you're about to say grace. Press the heels of your hands together and gently lift your elbows. You should feel a big stretch at the bottom of your forearm. Press them together for about 30 to 60 seconds. If you feel the telltale signs of the tingling and numbness in those 6 fingers that we brought up earlier, then bingo. That's another sign that the median nerve might be under pressure. All right, now let's tap into the Tinel's test. Use 2 fingers or reflex hammer and gently tap over the carpal tunnel, just below the base of the palm 4 to 6 times. If you get a zap, tingling, or electric sensation shooting into your fingers, especially those 3, that's your median nerve saying, yeah, you're being bugged. Simple, quick, and super useful. Now, for our final official test, Durkan's test. Take your thumb and apply direct, firm pressure right over the carpal tunnel, about an inch below the palm, centered on the wrist crease. Hold the pressure for 30 to 60 seconds. If you or your patient start to feel numbness, tingling, or symptoms firing off into the hand, it's a strong indicator that the median nerve is being compressed. And hey, here's a quick bonus. Check your grip strength. Grab a towel, water bottle, or anything you can squeeze and compare both hands. If one feels way weaker or fatigues way faster than the other, especially in the dominant side, that's one more clue something might be going on in your wrist. It could be carpal tunnel. Make sure you do both sides the same amount of time. This is not a diagnostic tool, but it helps you build a full story so when you go to the doctors, you can tell them all of your findings and he can help you diagnose your carpal tunnel. Ouch. And there you have it, 4 simple tools for at-home tests for carpal tunnel. If you're a massage therapist, use this as part of your toolbox to better understand your patients. If you're watching this for yourself, just remember, this is not a diagnosis. This is a tool. If symptoms stick around, go see your doctor, please. Thanks for hanging out with me. I hope you learned something. Please consider subscribing or leave me a comment below if you have any questions. Do me a favor, give that like button, a little tip open for me. Mwah! Love you guys.